Hi guys, it's Said from Elite PT Courses. I'm here today with Ty from Gym Therapy. As you can see, I'm seven days post-op. I've had an ACL reconstruction, and obviously we're looking to give you guys as much information about this kind of injury and training and nutrition as possible.
So we're looking at Said's knee today. Like he said, he's 7 days post-op from an ACL reconstruction from a hamstring graft. He's also had a medial meniscectomy as well. So this is slightly more complicated than your average surgery. I know Said for a long time. He's performed in a lot of elite level sports, so he's looking to enhance his rehab and get back as soon as possible. Obviously, he also runs his elite PT courses, and he wants to be an inspiration to obviously all of his personal trainers and those guys that are taking on his course, and take you through his journey from start to finish. So today we're day 7, and we're going to have a look at how he's been progressing since he's been released from hospital. He has his brace on, which restricts his movement to 90 degrees. He's still mobilising with 2 crutches, and really what we want to do is try and normalise his gait pattern as much as possible. So I'm going to ask Said now to turn and have a walk towards the track in the middle of the Olympic Centre, and I'm going to have a look at what he's doing there. Okay, that's excellent. So what we've got obviously there is Said walking as much as he can as pain allows. He's taking some weight onto that leg, but not all of it. He's doing what we call a step 2 gait, meaning that his injured foot moves first and his good foot follows and matches, but doesn't pass it. So what we want to do first of all is try to correct that, along with the fact that he's got a flat foot landing, we would like a heel toe strike, which obviously, while his quads are not working as well as they should, and his hamstring is quite restricted, he might not be able to get that full extension that we would look at. So we're going to try and work on those pointers now, Said. So what I want you to do is plant your crutches, land with a nice heel and straight leg, roll onto your foot and follow it through, and try to step past with your good leg. Absolutely, lead with the operated leg first. Good leg to pass it. So crutches, bad leg, good leg pass. Good. So I'm really trying to encourage Said to land, plant the foot and then come through. Very good. And just you see in 30 seconds time, just from practicing that once, he's already got a better quad activation, he's also got a better extension in that leg, he's taking less weight through his arms. So we're going to take that one step further now. We're going to ask him to repeat the same thing, but really try to use his arms as little as possible, and try to normalise that gait pattern one more time. One of the most important things when we're at this phase of rehab is to monitor what we call activity-related swelling. What we don't want to do is aggravate the knee so much with activities by loading it that it swells too much. He will have a baseline level of swelling, which I've asked him to monitor with things like the compression bandage, with elevation, with ankle pumps, and with some soft tissue massage. But it's important that when he does his rehab exercises, he doesn't aggravate that too much. That was excellent, Said. Well done. How did it feel to walk like that?
It felt much better, a lot more natural. The only thing I'm experiencing now is obviously naturally a lot of pain in the hamstring graft. But as I said, it's just that trying to get that normality back into it, which really aggravates it. But to be honest, it felt a lot better second time round.
Excellent. So what we'll do now is we'll do another video in a short while, and we'll have a look at his range of movement in the knee specifically, and see if we can work on any exercises that might improve his hamstring range and his quads activation. Bye for now.